Hello, everyone. How you guys doing? Good afternoon, good morning, good evening, good night, everyone. All right. Tony Prino, please can you send in a video request, ma? Send in a video request to join the live. Let's see if I can add you from my end here. Let's see. Who live?
Hey.
Hello. Hello,
First time in
everybody.
history.
Yeah, I'm joining.
First time in history. I'm happy. I'm happy. I'm so happy. I'm so
Hello,
happy.
everybody.
Yes.
Thank you. Thank you.
Yes. Can everyone hear the audio very well? Because I see people saying audio. Can you hear me? You can hear me.
Can you hear me too?
I can hear you loud and clear.
Okay.
All right, everyone. Good morning, good evening, good afternoon, good night, wherever you might be hearing me. As we all know, every Sunday, this is how we do it. It is called the Pitch the Plan series for the Tinubu Shettima 2023 campaign. So this is where we explain what is in the Renewed Hope. It is an 82-page 80 pages or 82 pages, over 80 pages action plan. It's a manifesto. It talks about all of the goodies that the Asiwaju administration is promising Nigerians. And what we do here basically is we explain, in details. Every week, we pick a subject and we discuss that in detail because we know that a lot of people may not have the opportunity to read through all of these 80 pages. So we bring in professionals from different fields, and they come to speak to us and explain what is in this manifesto. Introducing myself, Ayode Chibakare, popularly known as DJ Bongoli. And today, I know you guys are not seeing Mama Tuzi, that is Yetunde Yusuf, and also Barrister Bisiriyu. They have personal engagements that they are taking care of. They should join sometime, but without further ado, I have a special guest here. She's one of our team members, and she's our special guest today. I would like for her to introduce herself because today we are talking about healthcare, and she's a top of the line healthcare professional. So that I don't in English it means I don't take the morsel of pounded yam small for her. So I would like for her to introduce herself, and then before we continue the program. Thank you.
Yeah, thanks, Mr. Bongoli. Thanks for the honor to be on this platform. My name is Tony Adewale, known as Tony Prino on social media. I'm a physician by training, and I'm into drug development and also patient care, and a philanthropist. If you see my platform, I'm into a lot of charitable activities, and I'm happy to be here this afternoon. Thank you.
Thank you very much. Thank you very, very much. She did not add all the extra things about herself, like MPH. I don't know what that means. That tells maybe master in philosophy in
Masters
medicine.
in public health. Masters in public health.
Masters in public health, MPH, yes, masters. Me to have my own masters in chemical engineering too. So you cannot come and be threatening me. I All right. This weekend has been a good weekend for me. I cannot complain. I hope yours is It's going on smoothly. And to all of the
Yeah,
people that are
only that it's
watching us,
cold. It's cold.
it's
I
cold.
don't know whether
It's not cold
whether
for
you
us here.
have,
Look at
yeah, in
see
Texas.
my
So.
dress. See my dress. It's Texas.
Yeah.
Yes. All right. Moving forward. Today we're talking about healthcare. And healthcare is a very big topic because when you rate countries in the world, look at what they call the HDI, Human Development Index or Human Development Capital, and then it has three pillars of support. One is healthcare, the second one is education, and the third one is standard of living or standard of life. And we are discussing one of the pillars today. And healthcare in general, in Nigeria, is something that needs improvement. We cannot say that we are top of the line in Nigeria. And some people can say that healthcare is non-existent. Hopefully, she'll be able to shed more light as to why healthcare is the way it is in Nigeria and what we can do. You know, okay, not what we can do, but where is healthcare right now in Nigeria? Because from the little knowledge that I know that we have one of the worst ratios when it comes to doctors to patients. I know that we don't even have up to 35,000 doctors in Nigeria, medical doctors in Nigeria. I know that we are over 200 million Nigerians. I know that ratio is about 1 doctor to 6,500 Nigerians. I also know that the target, according to WHO, is you should have maybe 1 to 1,000. But I'm speaking to a medical doctor here, so to be able to shed more light. I also know about the JAPA syndrome of all of our doctors and nurses and healthcare professionals. Everyone is leaving Nigeria. So before I even begin to talk about what we have in the action plan as regards healthcare, I would just like Madam Toyin Prinor, Ms. Toyin, to please just tell us just a little synopsis, just brief, like where are we in Nigeria's healthcare? What is the problem? What are the problems? Not solutions here, just tell us what the problems are in just 2-3 minutes. Thank you.
Yeah, I think that the main thing is that not as much focus has been placed on healthcare generally, and people don't really pay attention to their health too. So we have the side of the people, and then we have the side of the government. So in terms of the people don't really, they don't believe in preventive care. They don't believe in checkups. They will say that they are not sick, they are okay. And they don't really want to care for their body. They prefer to look good outward and not pay attention to their body. Because this is the engine that carries us. So we should pay attention. So that is the side of the people. So I believe there is lack of awareness of preventive care, eating healthy, being physically active, and going for physical. Because here in the US, we go for annual physical every year. So which at least at the minimum, you go and see your doctor. So people on that side, that is the side of the people, lack of awareness and being health conscious. I know it has improved compared to before. People are a bit more health conscious, but at the same time, they are not doing enough. So on the part of the health system itself, which I'm not really saying accusing finger to the government, is that the system of healthcare in Nigeria is pay for service. So health insurance, even though it's coming up now, is not as common because a lot of people are still self-employed. They are business women, they are market women, they don't have health insurance. So you have to pay for service. You have to pay before service, not just after. They will tell you to deposit, go and deposit this. Even when you bring accident victim, go and deposit this. I remember when I was doing my housemanship at University of Ilorin Teaching Hospital, there was this girl, a young girl, that was brought, had typhoid, but the parents kept her at home. They were living in the village. So she came. They said to be able to be operated on, they need to go and deposit in a certain amount and pay for operation pack. And the parents didn't have money. And I looked at the girl. I just saw that this girl would die. There's no way. She was very septic. So it's paid for service. So I had to go to meet the CMD then, the chief medical director, and say, oh, can we get a waiver so that the parents promise they are going to pay? They said because they have had a lot of situations that people will not pay, that I had to sign an undertaking so that if they don't pay, they will take it from my salary then. That then salary was 17,000. That was way back in 98, 99. Then salary was 17,000. That they would take that operation pack was a lot of money then. That they would take it from my salary. I had to sign the undertaking because I saw that the girl would die. The girl would die. We would just be looking. We had to go in quickly and just operate on her and reset her intestine. It was perforated, typhoid perforation. So that is part of what I'm saying. How many doctors will want to do that? Some have done that. I just made up my mind that, okay, they don't pay, no problem. But the mom was very good. She paid the money. She paid the money. She kept to her promise. And one thing that made me happy was after we did the surgery, I assisted the pediatric surgeon because I was in pediatric surgery rotation. So I assisted him and it was successful. Put her on antibiotics and everything. She recovered well, though she stayed for some time on the children's ward. So I went and I remember coming into the ward. She came from her bed and knelt down to greet me. And that really gave me joy that at least I was able to save somebody. The girl would have died. So many people like that, they will be bleeding and they will say, look, you have to go and pay this certain amount before they can even attend. I don't think that is good. We have to find a way to mitigate that. I know there's the issue of trust, because if you say, okay, you are doing it, we are doing it, you want to help, you will just find out that they will run away from the hospital after they have been treated and they are okay. So we have the issue of the people, we have the issue of the healthcare system itself, in which is pay for service mainly, and then the government to not putting much focus and emphasis on healthcare. So I think I rest my case here. I hope I've not talked too much.
No. In fact, I even have questions to ask you, because normally I don't ask questions per se. I'll just let team members speak. But there's some things that you said that intrigued me. And one is, a lot of people are not aware that the government passed a law. And the law that they passed, I think it was in 2017, this gunshot act, that when somebody comes in with a gunshot wound, that they must get a police report. So in 2017, they passed a law that is not acceptable. If someone has a gunshot wound, you go and care for that person first. You take all the necessary protocols, but you don't need that police report. But hospitals are still pushing people to go and get the police report in violation of the Nigerian law itself. And there was one part also that I'll ask you a question on, because I know you said that, part of your profile is on the drug side, like the medicine and the drug side, and the research and all of that.
Yeah.
I know we have issues with drug manufacturing in Nigeria. We import, if not over 90% or maybe even 100%
of drugs. I think it's only like paracetamol also that we have some pharmaceutical companies, but I don't think they're even big. They just do pain medicine mainly, maybe some antibiotics and maybe IV fluids, probably. So I don't
So now,
think you are very correct. We don't really manufacture as many.
so now let me now ask you this question. Why don't we, or why can't we? What are the problems? Because Ashwaji talks about solutions here. So what are the problems? Why is it that we have to import our drugs, our medicine into Nigeria?
I think it's the mindset of people, mainly mindset, because I remember while I was, sorry, I will give examples. While I was
That's
doing
fine.
my house job too, the maternity wing, I remember we want to induce labor at that time. And so we had to buy oxytocin, which is a medicine to induce labor. We put in IV fluid to stimulate the uterus to contract and push out the baby. So I remember that we wrote, usually you write prescription for the relatives to go and buy at the nearby pharmacy and bring. So they brought it and we put it in the IV fluid. 6 hours, no contraction in this woman. So, and then I called my senior registrar. I said, what is happening? There's no contraction. What is happening to this day? I've been monitoring, and even the nurses too. So, and then they said, oh, this brand is from India. Go and buy a UK brand. So, and then they bought UK brand. Could you believe just one vial? We didn't use the other vial. The woman started contracting. So, mindset of people, number one. Number two, the issue of counterfeit drugs. So let's say now I want to start manufacturing that oxytocin in Nigeria now. And
Hold on, man.
I started.
Is there the capability of, do we have the capability of making it? I'm saying if everything is working like it's supposed to work, can we make it in Nigeria?
We can make it. We can make it. We
Okay,
can
I
make
can
it.
continue.
We have the brains, we have the people. You know, we have the brains. We can make it. We have
Do we
good
have the raw
chemists.
materials? Do we have the raw
We
materials?
might not have all raw materials, which we call active pharmaceutical ingredients. We might not have all. We might need to import. We might need to import. So we might not have all, but we have the capability. We have the brains. We have the people. We can build we can import the equipment, because we know we can make all equipment depending on which ones. You know, there are some that we can make, but we have the capability. I believe that we cannot say we cannot do anything in Nigeria. And generally, that is my own philosophy. Nothing is impossible if you believe and if you have that mindset. So everything is about mindsets and getting the resources together. So now if I say, okay, I want to manufacture oxytocin, okay, what are the active pharmaceutical ingredients that I need? Okay, what are the machines that I'm going to need? I need to consult other people that have done the same thing. If it means going to those countries that manufacture to really see how the manufacturing is done, so that we can do the same in Nigeria. And I believe the most commonly used medication is pain medicine, paracetamol, that people use. Yeah, in Nigeria, paracetamol. So, and I know they still have fake counterfeit drugs too.
Now let's talk about that, because we need to give an example. This will be the last one, because we need to give an example. Sorry for cutting you short.
Yeah, no problem.
If you wanted to make oxytocin or something like that. So go ahead, man, on that. Counterfeit the problems. Yeah. Go ahead, man.
Yeah, so the issue, like what I said earlier on, that they bought a brand that was made in Karachi, India, and it did not work. And then my senior registrar then said, go and buy the one from UK. And they got that one. It was more expensive, of course, but it worked well. And the woman delivered the baby successfully. So that really matters. Now, how do we, the issue of counterfeit drug is a different discussion on its own. Because we need to have, I know the NDLE, they are doing their best, but I think they need more resources. Because if they are able to crack down on those places that they manufacture those fake drugs, then at least we'll be able to reduce it to the minimum. And if there can be restrictions too on chemists, you know, chemists, anybody can open chemists to sell drugs. We should have a form of, I don't want to be mean to say that there should not be chemists, but they should undergo training on how to recognize counterfeit drugs. Because I think those majority of people that have chemists, their goal is to make profits. Some of them might not even be trained. Some might be auxiliary nurse. Some might not even be trained at all in medicine or health-related subjects. So they need training on how to identify counterfeit drugs too. It's very important because the NDLE cannot do it alone. And also people should be conscious. They look at what they are buying. If it looks different from what you usually buy, you better talk to your chemist and say, this looks different. Where is this from? This does not look like paracetamol now. If they give you and it's looking yellow or it's looking creamy, when you open it, because most of the time we say, okay, buy the one in sachets. Buy the one in sachets, but those in sachets too, I believe now they are still making the counterfeit of those in sachets. Because I've seen videos of people removing like tetracycline from sachets and they opened it and it was not drug material, it was something else inside. So
Wow.
I don't know. It is a big issue. That's why I said it's a complete topic on its own. The NDLE, the people, the training. So it's a big one on its own.
We'll talk about it another time and let us move forward.
Yes.
So now, what I typically do is I will read a certain excerpt from the manifesto that says, hey, these are the things we are going to do. And then the manifesto breaks some of the things you are going to do, like then some subtopics. And then I'll ask you about those subtopics, what it means, what Ashewaju is meaning or saying is going to do. So that is the model that we adopt.
Okay.
Now, you have talked about several issues. So Ashewaju is now saying that we will therefore frontally address our nation's healthcare challenges, including inadequate health infrastructure, fragmentation, and overburdened workforce, poor insurance coverage, high maternal and infant mortality, inadequate preventative care, and dependence on imported medicines and vaccines. To rise to the challenge of improving the healthcare fortunes of our people, our healthcare policy shall entail, and then I'm going to go blah, blah, blah. Now, what interests me, what I just read now, it seems like you've already talked about everything. I mean the problems.
Yeah,
the problems. You talked about it because you talked about induced labor. You talked about maternity because Nigeria has one of the highest maternity rate, maternal mortality rates in the world, child mortality rates in the world, one of the highest.
Yeah.
Yes. You talked about that. You talked about dependence on imported medicines and vaccines, which you talked about. You also talked about poor insurance coverage. We talked about workforce. So this is going to be an interesting one. I like this because you talked about what the problems are. All right, now moving forward, because this is I don't have a background in medicine, so you pardon my naivety. You know, this is not my strong point. So just pardon my naivety. Firstly, Ashwaj is talking about health sector governance and leadership. So he's saying that he wants to bring in a synchronization between the federal, the state, and the local government, and make them accountable, and then try to see how healthcare can be improved on a community level. So what do you think Ashewaju is trying to achieve by that, or what is he saying by improving healthcare sector governance and leadership, bringing in the local government, state governments, and the federal government all together in synchronization? What is he trying to tell us that he is going to do?
That is unification of the three levels of government. Because Nigeria, the way it is that, it's not like here that, the county, they operate independently, which is the local government, and the state can operate independently. Somewhat in Nigeria, they can operate independently, but in order to have that uniformity and have that synchronization, there needs to be harmonization of the three, especially in terms of healthcare. And at the local government level, that's where you have most of the people, the communities. What it's trying to say is that to emphasize the importance of primary health care. Primary health care is very important, but they have not been paying attention to it. I believe way back, they emphasized it. Sorry, I'm always giving examples. But
no, that's fine.
when
No,
I
we need the examples.
yeah,
We need
so
the examples.
when
Yes,
I
we need
did
the
my
examples.
youth service, in Eshan West local government, Ekoma. So at the local government center, they had the mobile clinic. So I served there. But let me tell you, that was bought by late Professor Ambrose Ali, who was then the governor of Bende State. So he bought it, and he was going to the villages. It was a mobile caravan that drivable. But when I got there, it was non-functional. The inside very good, like a clinic that people come to me, they come, all the local government staff, they come, I check their blood pressure, I prescribe medication for them. But and I had to go to the chairman and told him that, look, this is not performing what it's supposed to be. It's supposed to be going to the communities to treat people, to educate people, and everything. So, and then I said, okay, they will organize a program. So I wrote a proposal for a program. So even though it eventually boosted the chairman's political ambition, but
Of course.
I just,
Of course.
I proposed it, and I didn't get anything from it, because eventually, even though he said, oh, he gave me an award for 10,000 naira at that time when I was passing out, but you know what? I was not giving that money. The people in charge of the money did not release the money. But I was happy. They didn't release the money. They didn't release the money. So I just gave up and left it. But I was glad that we were, because I organized like 3-day free healthcare, that we went to different villages. I saw a lot of them. At least I was able to educate them on health. And some of them I wrote referrals for them to go to teaching hospital in Benin or go to Auchi, whichever one is closer to it's more convenient for them to go, because Ekpoma is equidistant between Auchi and Benin. So whichever one. So I wrote the referrals, I treated them. So it was good. So that was really fulfilling for me, because that was the purpose. How many of them will even come from their village to come to that stationary mobile clinic? It was supposed to be a mobile clinic going about the villages, but it was branded. But I was posted there. At least I was able to make the impact to do like 1, 2, 3 outreaches to go to the villages, even though it boosted the chairman's political career, but at least I was able to fulfill my own purpose in getting to the people. So primary health care is very, very important. And I believe that the clinics, the community clinics, will be revamped by Achiwaju's regime. If he were to be elected as a president, they will be revamped, because so that they will be less dependent on teaching hospitals. They will have to hire good physicians and nurses and train them, and there should be continued training, because one thing that I noticed in Nigeria is that there's no continuing education. So there should be continued training. It's not that, oh, I'm a physician, I'm a consultant. There should be required continued education. Because generally the world is not stagnant. So not to talk of medicine, even engineering is not stagnant. The way you look, we have electric vehicles now. The way buildings were built 10 years ago is not the way buildings are built now. So it's dynamic. It's a dynamic world. So there should be emphasis on continuing education to improve the knowledge of the physicians, the nurses aid, everybody working in the clinic. And also there's the need for the mindset of that, oh, I don't want to, some of the, I'm sorry, I don't want to be, but, some people have the mindset that nurses are not as nice in Nigeria. So which is not supposed to be. I've worked with nurses, they are nice people. I'm not stereotyping. They are nice people, even in Nigeria. So, but the mindset that people should be more interested in their work. It's not about, oh, because some will come to work as if they are being bothered when patients need help. And at the same time too, patients should not be over demanding. So, and also that brings me to the point of hiring more people. They need more people, more workforce. Encourage them. What are the incentives? Incentives to be given. That, okay, if you are going to work at the clinic in the suburb of Abeokuta, not in the main city. If you are going to work in that city, like Kobakpe, you want to work there. It's a remote place. So you have to incentivize the doctors and the nurses and the nurses aid, everybody to make that, and also equip that place to be standard, at least standard that they can give first aid or emergency treatment, and then stabilize the patient before referral to a bigger hospital.
So now with what you have said now, this is what Ashwaju is saying. Ashwaju is saying that, you talked about those mobile local clinics, right? He's saying that he would ensure that you have those mobile clinics with, I think, about 3 kilometers from wherever you are, or a 30-minute walk from a private facility. Now, he also said that, because now you also touched on the primary and secondary healthcare, he also said that in every local government, there's going to be a general hospital. He also says that in every state, there is going to be a tertiary facility. Now, when he says tertiary, I'm thinking is maybe a university that has like
teaching
hospital. Because I know that in Nigeria, say, LASUTH, that's Lagos State University Teaching Hospital, is the best. It says number 1. They do a lot of surgeries there and all of that.
Yes, they really improved.
Yes, really improved, because the Ashwaju administration at the time, maybe they really invested in it, billions of naira, and the Lagos state government keeps on improving on it. And that is what Ashwaju is promising to bring to Nigerians. And also, he also said that in every geopolitical zones, now when we say geopolitical zones, we are talking of Northwest, Northeast, North Central, Southwest, South, and Southeast will have a specialist hospital. So those are the things that he's saying that he's going to do as regards, because you talk about primary and secondary healthcare, and at the beginning of the program, you emphasized on the need for people to have access to primary healthcare, and that is what the Ashwaju administration is promising. He wants all Nigerians to have access to primary healthcare. He's also saying equity and quality, because like you said, as a doctor, for example, or as a nurse, for example, why will I go and want to work in, will I say, Ihiala, local government area in Anambra State, when I can work in Oka, or I can work in Newi, or I can work in Onitsha, I would rather want to work in those places than in Ihiala or Idiato, you know, or Lu in Imo State. I want to work in Owerri, you know. So what he's now saying is that we will incentivize, we will employ more people. But before we begin to talk about all of this, we need to have the funding. A lot of people are pretty much will say we want this, we want that, we want that, we want this, but there needs to be funding.
Yes.
The fund needs to be available to perform all of these services or give all of these services for the good of all Nigerians. And we are already blessed with somebody that knows how to generate revenue. And that is Asiwaju Ahmed Bola Tinubu. He knows how to generate revenue. He has a think tank, because no man is an island, and that is one thing that he prides himself in, is I have people. I have people that if I lock them in a room, they are going to spew out ideas. And then we're going to work on those ideas. And then we are going to, you know, we'll just wait and see the results. Because a lot of people have this impression, let me even address this a little, since we're talking about health. Oh, his health is this, his health is that. I always tell people, is it his health that we need, or is it brain that we need?
Oh, yes, the brain.
It's his brain that we need. It's not. And when you talk about health, you don't have his medical reports. He may even be healthier than you that you are saying is not healthy. You that you are saying is not healthy, when was the last time you did your own medical checkup?
Yes, and that is what we are emphasizing.
Yes, at least we know he does medical checkup, because they say we travel to London or we travel to Paris for medical checkup. At least we know he goes for that one, which we want our leaders to be able to stay in Nigeria and do their medical checkup. That is what we want.
Yeah.
And I think, what's his name? Vice President Yemi Osinbajo did a surgery in Lagos State last year, I think on his knee or on his leg or so. Some part of his leg. He did it, and it was like a big fanfare. Like, our leaders are doing surgeries in Nigeria. Our leaders, you know, getting healthcare services and all of that, healthcare services in Nigeria. Now, as a leader, and I think that maybe the culture back home and the culture with maybe people that have worked outside of Nigeria in a work environment, in a corporate environment, the work ethics may be different. There might be clash of work ethics, because one thing that I know for a fact is, as a leader, because I'm also more like a leader. I'm also like a leader at my job. My role is to make sure that my subordinates have all of the tools they need to succeed.
Absolutely.
It's my role. And whatever they do will make me look good.
Absolutely.
All you have to do is to bring the reports to me. And I say, why didn't we hit the target? We didn't hit the target because we don't have enough money to run this particular program, or we don't have the manpower, or we don't have this skill set. And as a leader, what do? I will provide the funds. I'll provide the resources. I will provide the access for you to succeed. That is my role as a leader.
Oh, yeah.
You do not expect me as a leader to understand everything going on.
No.
I don't need to understand everything going on. All I look at is key performance indicators, KPIs.
Absolutely. That was what I wanted to say. Look at it. Average, like on a monthly basis or bi-weekly basis or quarterly.
Yes. Let me wear my professional hat here. Let me just wear my professional hat here, not the DJing one, my engineering one. And because I'm a professional in the two of them. Every morning at my job, I report some certain KPIs to my boss. Every morning, I must tell him how the plant is running. Oh, there are some key operating parameters that we didn't hit. Okay, what is the percentage of these key operating parameters we didn't hit? Oh, did we hit production? Now, why didn't we hit production? Then I have to explain. Why didn't we meet our production targets? I have to explain. Why did we have these safety issues? I have to explain. Why do we have all of this, whatever it is, that's all he sees. He doesn't need me. He doesn't need to know all of those, whatever it is, because whatever I tell him is what he's going to take and go and report to his boss. You can't expect his boss to be asking him, why didn't this work at this time? That's not his role. He's not a micromanager.
Yeah.
And that's why we're talking about healthcare, for example. The healthcare, for example, that we're talking about is healthcare. We need his brain. That's all we need. He just look at the KPIs and report to Nigerians. And with this manifesto that we have here, you can deduce your key performance indicators from the comfort of your room. Oh, he said he's going to do this in 4 years. He said he's going to do this in 10 years. He said he's going to do this in 1 year. Why hasn't he done it? You can look at it for yourself here. And that is why when we are talking about healthcare here, for example, these are the things that he says he's going to do to solve primary and secondary healthcare issues. Because every local government is supposed to have a primary healthcare center.
Yes.
This is not about the general hospital here that we're talking about. A primary healthcare center, according to our constitution. I know in Lagos State, I know that all of Lagos State, in each local government, they have primary healthcare centers.
Yes, they do.
That one
They do.
But I do not know about other states. Or if they have, how functional are they? Because we see them in videos, on the news, on social media, and we don't see, these hospitals, So please, if you have questions, just hold on the questions. We're not yet in the question and answer session. I'm seeing people talking about, I asked a question. Don't worry, we'll get there. Once we round up with this, then you'll be able to ask your questions. Please call me Wave, please. I beg you. You ask your question. Thank you. So let's move forward. Now, let's talk about, you've talked about preventive care. Ashwadu is saying that with preventive care, his plan is to work with state and local governments to ensure vaccinations, eye tests, cancer screening, blood pressure monitoring, and diabetes for early detection of illnesses. And he says that such preventative cares services will be grassroots-based, gender-sensitive, and affordable. And I think you touched on all of this. You spoke about all of this, and these are the that Ashwaju said is promising. Now, let me get to one quite a bit technical. And there's something that Ashwaju said about it that I really like, that interests me. Now, health financing and national health insurance. That's a big one. It
is.
So now, Ashwaju is saying that his target is to ensure that our health insurance covers at least 40% of the population. So I'm saying he's looking at 80 million people, because let's say, for example, we are 200 million. We're over 200 million. So I can say over 80 million people. That is his target, to ensure that they are in the health insurance, that they have health insurance. And it's also laying emphasis on health coverage for pregnant women and kids under the age of 5. He's also putting special preference for them. And I'll let you just talk about that. What is Ashwaju trying to achieve with this? Him saying that he wants to ensure that about 40% have health insurance, and laying emphasis on pregnant women and kids, because I know you talked about pediatric side of healthcare. So can you just tell us what Ashwaju is trying to achieve with that? Because there's something that I talked about. There's a promise he made here that's really interesting.
Yeah, what he's trying to say is to be able to make health insurance affordable and available to people. at least 40%, which is realistic enough. It's not even saying 70%, because is a big one. You have to consider those that are working for the government, those that are working for the private sector, to probably incentivize the private sector, that have employees that if they offer health insurance to the employees, they might have some form of tax incentive. So which will really motivate them, because the private sector, in Nigeria, if you have, let's say like you hire like 10 people, you have a store, will you be providing health insurance to them? So there needs to be, they can be that, okay, if you have more than 50 people, like the Obamacare that was mandatory here, which helped people to have health insurance. So something to that effect, that if you have like 20 or more employees, we are going to give you tax incentive if you offer them health insurance. And also to those in the to the government sector, they don't have, most of them have insurance through the job. That is to the best of my knowledge. So that they are covered. So it's mainly the private sector and also the market women, the people that have stores. It's just one man business. So how do you? So there should be affordable health care for them, which will be good, at the same time affordable to them. So probably have like the marketplace, like the Obamacare, have different health insurance, and review the health policies of the coverage for those health insurance, because health insurance generally, you need to read the fine print. It's about the money, whether health, whether life insurance, whether car insurance, you need to read between the lines. So I think if he becomes the president, he will look into it even beyond what he has written, because he will need to have subject matter experts in healthcare and also insurance. Have subject matter experts to come together and look at the different healthcare insurance that we have in Nigeria, and review their health policies and review their coverages, because some might have stringent coverages that, you cannot see your doctor more than once in a month, all those stuff. So to make it more flexible and not just about the profit that they are going to make from it. So review it and then think about how they're going to make it affordable to the market women. How do you bring them to have health insurance, so that at least, like I said, and I like what Achiwaju is really tackling, preventive health, preventive medicine, so that they do check up. It's not that when they now have kidney problem from high blood pressure, unmanaged high blood pressure, then they will need dialysis, which they may not be able to afford. Try to educate them. Let them, if they have family history of high blood pressure, they know that they have that risk factor to develop it. So, and if they have increased weight, I would not want to call it obese, maybe overweight, like that. They know that they need to watch what they are eating, they need to exercise. And if they have the high blood pressure, they should be cancelled, because some people still have that notion in Nigeria that they don't want to take blood pressure medicine.
Yes.
They don't want to take blood pressure medicine, which will prevent stroke.
Go ahead. Yeah, hold on. Mama Tuzi, can you join us? Can you join us? Because we just have 15 minutes.
Yeah, she just
15 minutes, so that we can bring you in.
Yeah, so Mama that she can say her stuff. So
yeah, but go ahead, ma. But before she requests to join, I want to talk about, because it is one of your fields also, domestic research, and I'm thinking it's related to drugs. Oh, she's driving. Okay. I'm sorry. You can't. Let's see. Let's keep going. Let's talk about domestic research. So Ashwaju says, work with the private sector. We shall encourage and fund local research for new drugs, vaccines, and disease epidemiology. determining best approaches to disease management within our local context. And he says he's going to release some funds to fund health researches and drug researches also. But before you talk about that and what he's trying to achieve, Ashwaju said something about consumption tax on alcohol and tobacco, and using that funding to fund healthcare. Using that funding to fund the healthcare insurance part. I think that is a beautiful.
Good. It is
yeah,
good.
So he's saying anything consumption, the consumption tax on because alcoholic beverages also, some school of thought to say, I've seen where they say beer is good for the heart, but I know that beer at the end of the day,
not really beer, maybe red wine, because of some form of antioxidant. It's not really the alcohol itself. So I will not even recommend alcohol like that, because alcohol has its varieties of ill effects.
Yes.
So instead, I will recommend that you drink, you eat fruits that can give antioxidants rather than relying on red wine and say, oh, red wine. But it's a very small volume. But people would say, oh, it's good, and they will consume the whole bottle of red wine. That's not right. That's not what is recommended. So in my opinion, I would rather say you eat fruit that will give you antioxidants rather than relying on alcohol, red wine, for example, because of antioxidants. So I know that proposal by Ashiwaju is good, because it will make people to even be healthy, lifestyle modification. If they were smoking, let's say, 5 packs of cigarette per day, for example, because of the high tax, though they will grumble and say, oh, you see, now they don't want us to enjoy our life. But in actual fact, cigarette is not about enjoyment. Nicotine is you'll be dependent on it. So It is bad. It is bad for the body. It's not good. So I know people will not like it, but that is the way to fund the health care, while at the same time encouraging healthy lifestyle, which is important. And the same thing here in the US too. The cigarette tax is very high, and it's been increasing every time. It's very high. So it's not something that is out of the blue. It's done.
In fact, when you're registering for your healthcare insurance here in America, for example, they will ask you if you consume tobacco.
Absolutely.
And if you consume tobacco, you will pay more for your insurance taxes. They remove more money from your check.
Yes. For instance, I'm also into life insurance. I'm an agent for life insurance. So for life insurance, if you are a tobacco smoker, you pay more premium than a non-tobacco.
Yes.
So that is it. It's a realistic question to ask. And there's no health questionnaire that they will ask you, do you consume tobacco? Do you smoke cigarette or consume tobacco? You're going to respond to it. It's very important.
Yeah, you have to. Yeah, you have to. Now, moving forward, it talks about the next public health emergency. Now, with the next public health emergency, it's talking about the lessons learned during the Ebola and COVID-19. Because Lagos State, imagine if Ebola and or COVID came in through any other state in Nigeria.
In fact, especially that Ebola, I was supposed to travel to Nigeria. I had to cancel my trip. So, but the way it was curtailed, I was very impressed. I was very impressed the way it was contained, and of blessed memory, that doctor, yes,
Sarah Dadivo.
yes, she really, she's, I would not say she is a hero, because
Yes,
what she did, she saved a lot of lives, a lot of
yes,
lives.
yes,
And the awareness was really great in Lagos and everything. They really, I was impressed the way, and also COVID-19, the way everything to lock down Lagos. mm, I couldn't believe that Lagos can be locked down, but it was locked down for COVID-19, which helped. And
yes. Ashwaju is
that
now
is it.
saying, so Ashwaju is now saying that that particular model in Lagos State, we want to push that forward into different states.
Yes.
That particular model, we want to push those particular models into different states in Nigeria. Being able to have the available facilities, because for the COVID-19 in Lagos that came into Lagos, for example, I know they had lots of
Yes.
They
They
had
had
lots
a
of
lot.
wards. They
They
have lots
had
of
that they and the way they constructed all those, the isolation standards, very, very fast and good standard, because I saw all those pictures, standard, and it was really impressive.
yes. All right, now, I want to talk about mental health and drug abuse. Ashiwaju is laying so much emphasis on mental health promotion and orientation programs for at-risk population to reduce the incidence of abuse and illness. In Nigeria, I know that we don't pay attention to mental health,
Mental.
but I'm seeing that the Buhari administration, because I saw when I was doing some research lately, I came across like mental health awareness programs, mental health services in Nigeria, and I was somewhat impressed, but we are not where we are supposed to be, but at least there's a starting point, and Ashiwaju is saying that it's going to take it up a notch. And also, he says that we are going to train, because remember, you always emphasized on training.
Training is important.
You emphasize on training, like training healthcare professionals on how to detect someone that has mental health issues per se, and diagnose and get them into the right treatment regiment or regime or plan.
Yes.
So
Yes.
I want you to talk about that, like Ajiwaju is proposing all of this as regards mental health and drug abuse.
Yes.
What is your say?
So, yes, that is very important, because the training will be meant for those that are not psychiatrists. Psychiatrists are already trained to diagnose mental ill health. So it will be for maybe the general practitioners, the OBGYN, and pediatrician, and they should always ask questions related to mental health. Even if they come with headache, fever, which you suspect malaria, always ask how they are doing. And what I've noticed is that the same thing happens in the US too, because time is money too in the US.
Of
You
course.
go, they just 10 minutes, they are done, but they will have asked that question. Usually they ask question pertaining to that during your annual physical. But if you go there, okay, you have a cold or you have cough and you need antibiotics like that. So they they will have asked that, oh, in the past 6 months, have you been feeling sad? So I know it might be somehow when you start training physicians in Nigeria that, oh, when people come for headache or they have cough, you asked how they are doing. I think the general question, there should be a structured questionnaire to ask them that, okay, do you have anything troubling your mind at this time? Do you think you need somebody to talk to, so that they will not be able to, because the doctor might not have the time to listen to them, because other patients might be waiting. they should have like counselors or psychologists, even in private clinics, to be able to listen to such patients so that they say their mind, what is bothering them. And also, not only that training, the general people need to be aware of mental health. They need to be aware of the signs. Somebody that is usually cheerful and playful, now keeping to himself or herself. Somebody, and then you ask and they are saying there's nothing, they don't have interest in what they had interest in doing previously. Suspect that they had been depressed. And depression, mental health, mental illness is real. As physical illness is important, it's also mental health. So that awareness needs to, because lately we have seen so many people committing suicide.
Yes.
Before, when I was growing up, we didn't, no case of suicide. No case. We only saw cases of schizophrenia, you know, wandering madman on the street, schizophrenia. You know, that we saw. But depression, not really common to the point of committing suicide. But now, there is increased suicide now. You see people, they will be holding them from jumping off the cliff.
Oh, they jump into Third Milan Bridge. It's a they will jump into Third Milan Bridge from Third Milan Bridge.
Some will be able to do that successfully. Some they will be able to hold them. You know, it's not right. So there should be that awareness. It's not starting. It does not start in a day. Somebody that wants to commit suicide unless under the influence of drug. So now that will move me to drug abuse too. You know, we have that other side too. There's need to really educate the youth and all the people, because it's not only the youth that abuse drug. So it starts from abusing over-the-counter drugs to all those mixing. So all those stuff, you need to educate them to going, because that's where they progress, to all those labs that they just mix stuff together. And they say that, okay, like Colorado, they go to Colorado without flying. All those other ones like that. So like that. So we need to look, this will give you only temporary, like 1 minute euphoria. But thereafter, it's damaging, and you are going to be dependent. You are not going to be, you don't want to do anything, you are not motivated, so there is a motivation. And then if they don't have money for that drug, they can do anything to get the drug, and that's where crime comes in. So education, and then cracking down on those labs. And it's bringing me back to education of the chemists owners. So, and there should be restrictions on, like now, I cannot go to the pharmacy here and say, okay, I want to buy cough medicine. There are some cough medicine that they have to see my driver's license before they give it to me. It's recorded. Because people abuse that too. Here in the US, they use it for meth. So the same thing in Nigeria, all those potential cough medicine and other medication should be restricted. So that's where the NDLE needs to put more restriction on the chemists and the pharmacists not to be selling those. And if they have to sell, they need to take their information. And there should be a central database in which they will check if they bought in Maiduguri and they came to Lagos to want to buy again. So we need, it's a lot of work, but I know it's doable. It is doable.
Thank you very much, ma. Before we get into the question and answer session, I just want to add something here. And that is something I talked about, the need for preventative care, primary care, preventative care. Ashewaju is proposing checking your blood pressure. Is going to have that available to the lowest level of the society. That is from a community-based level, the local government-based level is looking at ensuring that loads of people have access or will have access to all of these services. Because when I speak with Yetunde at times, Yetunde will tell me, say, Bongoli, you know, they will say somebody was walking on the streets, slum, and die in Nigeria. Somebody is in the hospital, slum, and die. Somebody is playing ball, slum, and die. That's in Nigeria, one of the highest killers are cardiovascular related diseases.
Yes, high blood pressure. Yeah.
High blood pressure. High blood pressure, basically. But they will say that is a spell. The person has sudden death. And we need to ensure that we take care of ourselves. As you are just saying, you guys need to take care of yourselves. And I'm promising you that if you vote me in, I will ensure that all of these services are within 3 kilometers from you or 30 minutes walk from you. Now, it's time for question and answer. But there's something that somebody put up here that I want to quickly address. Call Me Wale said, malaria is already a public health concern that has not been eradicated. Mathematical models for elimination should be prioritized since it spawns an economic burden. Now, when we talk about malaria, I think when I was looking at doing some research on malaria in Nigeria, I think according to the WHO, they said over 80,000 Nigerians die of malaria annually. I think Africa in general, like sub-Saharan Africa in general, is doing maybe 80 to 90% of that malaria deaths across the world. And I think Nigeria is doing like 25% or something like that when it comes to malaria. I think I'll check my figures well. But I know it is something thousand deaths. But those are the ones that are recorded.
Yeah.
There are a lot that are not recorded.
They are not.
But we work on data. And Ashwaju is now saying something to address Kwame Wale's question. We shall also prioritize improving data collection and analysis to ensure that critical public health decisions are evidence-based and grounded in science. So yes, Ashwaju will be using all necessary analytical tools available to make decisions as it relates to healthcare, as it relates to whatever disease we're talking about in Nigeria. Because outside of malaria, we have Lassa fever. Lassa fever is a major killer in Nigeria right now. It is Lassa fever, especially you have it prevalent in northeast, north central. You have it a lot there. And Lassa fever is from rats. I think they are pigs or something like that.
Yes.
I'm not a healthcare person, you know.
Let me add to that Lassa fever. So yes, I think, and what Ashwadu is proposing in terms of research. So, and I believe he will be able to improve it because research in Nigeria has been, I would say, zero. I want to be frank, has been zero because I've been involved in research, and the issue has been that when they bring research proposal to Nigeria, like the HIV, when it was brought to Nigeria, the government did not embrace it. They did not. That would have helped HIV patients to get free drugs. That would have boosted the economy by employing nurses and other people, data managers and all the people that will work in that facility. So they did not embrace it. So embracing research is very important. It's very important, especially the issues of public health, like Lassa fever now and some other ones. Even HIV is still very much around in Nigeria. So then
they say they have the pandemic
even though we have antiretroviral drugs, there's still a lot of research still going on to get more drugs that will work well. And also cancer. Cancer is all over the world. It's not geographically dependent. So even though we have some cancers that are prevalent in some geographical location, so cancer research, there's still a lot of unknowns regarding cancer. And so, and I believe that if Ashwaju comes in, he will be able to focus more on that because people don't really prioritize research in Nigeria. Research is very important.
Thank you very, very much. Now that you said, guys, before I open the floor for you to ask questions, I think we just have like 3 questions on healthcare, and we'll call it a day. I think we've had one already. You touched on HIV, you talked on grants and funding and all that. I have the funny story, but not so funny story to share. I saw in the news that WHO released grants for HIV grants from Switzerland or something like that. And they chopped the money. They chopped the money. They brought the money in. It's Nigerians like you and I that chopped the money.
Imagine.
HIV grants. People should fear God now. So that is, so I just wanted to just put that in there. So anytime I hear, grants and funding and all of that, elimination of corrupt practices, sharp practices in NDAs, ministries, departments, and agencies. And I showed you already, we talked about it in the economic part. He already has a plan for that, how to solve that issue to the barest minimum or to a certain extent. He's not saying, oh, we're going to eliminate it completely. Because remember, corruption starts with you and I. Corruption is not necessarily you are going to steal money. Corruption is when you are going, you are doing special center. It's corruption. Corruption is when you go to your local council development or local government area. You want to get an affidavit that you don't deserve to get the affidavit, but you find a way to get the affidavit. Corruption is when you want to go and get your passport. You pay extra money to get it at a quicker time. It's corruption.
Absolutely.
Corruption
Absolutely.
is when you are looking for a job opportunity. All of you write the exam, but because the person that is in charge of the exam is your daddy's grandfather's daughter's uncle's son's brother, auntie, whatever. And then they put you in there. And then you go to church on Sunday, or you go to the mosque, or you go to your traditional worship shrine and say it's the God or it's God that favored you when you know what you did. That is corruption also. So I leave it at that. Now let me go to the question that Call Me Wale asked again. Now these questions are for you, ma. He's one that has the first one. Now he's asking a second one. Social determinants of health have a linear relationship with health outcomes. How are you ensuring that in undeserved communities, the social determinants are adjusted? But before you do, somebody just sent in a request. Oh, the person ran away. I thought it was Mama Tuzi that sent the request. I was excited. Hold on, is she the one? She has sent the request. So it's 2 of you that answer this question. Fantastic.
Yeah, she's an expert in health outcomes.
No, I'm not saying that. I'm just saying 2 of you. Once I have the 2 of you, my mind is addressed. Yes.
There she comes.
Praise God. Hallelujah. Allahu Akbar. Allahu Akbar.
Alhamdulillah.
Praise God, hallelujah. In Jesus' name we pray, amen. I'm going to read the question.
It's my mom's birthday, and we went out.
All right. So let me ask the question again. Call Me Wale has been asking question that is disturbing my head. It's disturbing my brain because I'm not an healthcare person. You need to take it easy. Call Me Wale. Now, Call Me Wale, you can answer all the questions you want to ask now. We have plenty professionals. Anyone you want. Is it you want on-the-field experience? You want data analytical experience? Or answer 2 of them? You answer the question.
Dr. Tony can actually answer it more. That question is for her specifically because that's her area of expertise. Public health is her thing.
You too.
So
you are
now,
also in public health.
For the 2 of you. I read it again. Deploy for the 2 of you. Social determinants of health have a linear relationship with health outcomes.
Yes.
How are you ensuring that in undeserved communities? So I'm thinking maybe disadvantaged communities or remote communities.
Rural areas and all of that.
The social determinants are adjusted. So the floor is yours. Answer. I don't know.
You
answer.
Start. You
answer so that
Okay.
Toyin can rest a little bit. She has been talking for over 1 hour.
The truth is that most of the social determinants of health that we have in the United States is slightly different from what is causing a lot of the issues we have in Nigeria. A lot of the social determinants that are not prevalent in like the urban centers, but you might actually see in the rural areas or undeserved areas, it can be linked to their socioeconomic factor when it comes to income and everything. The people in the villages, for example, I will still say they eat healthier than people in the urban cities. So I can't really say it's their food per se. So when it comes to, in the case of Nigeria now, for example, people living in the undeserved areas in Lagos, for example, in the riverine areas and all that, most of the, yes, Laje community, Makoko and all of that, a lot of the things you can do also comes from awareness and education. Because how do you get people to eat healthy? How do you get them to understand that littering your gutters and getting it blocked can lead, will make, for mosquitoes leading to malaria, all this other stuff. Besides now, I know that Dr. Tony has already talked a lot about smoking and all these other ones. I know you've already mentioned a lot about that. So, but you can't, the reality is you really can't tell people to live healthy or eat healthy when they can't really afford to do that. We live here, we know how expensive it is to try to live healthy. Yes. It's expensive, that's the truth.
It is.
So even in Nigeria, it's not, that's the truth.
We don't understand
if you don't understand that, is a rich person that can eat egg.
Now that the eggs are even increased in price.
Even in America now, one egg that we used to buy for $1.99 is $6 still. I don't want to. We are proposing with egg now, not ring. But so. So the only way we can guarantee this is to bring up policies that will advocate for more enlightenment, putting more infrastructures in place in this community, social infrastructures in place in these communities. When it comes to social services, one advantage that America has that Nigeria doesn't have is the fact that there's social services system. There's safety nets that they have here. There are things that people can, resources that low-income earners can at least tap into to help them fight or live through that, whatever situation, socioeconomic situation that can help them. So that way they can live healthy. So for example, now a patient that has diabetes now, quite often you will see that there are diabetic centers around that are like support clinics for diabetes, or even for Alcohol Anonymous, for smoking cessation, all the stuff they are there. But what I can say really is that in the case of Nigeria, you have to deal with the poverty. Most of our healthcare situation problems in Nigeria is still linked to poverty. Of course, we have the ones that are linked to you are rich and you are overdoing things. That I'm not talking about that. But talking about our underserved area, people in the rural community, a lot of it is because now they really cannot afford to do the right thing. Not that they don't want to, not that they don't want to eat this particular thing that is good, not that they don't want to take medication or go to their doctor. First, they lack access to the healthcare facility. Second, they can't even afford their own medication to begin with. So even if they have something that is so minor that if they can get healthcare access immediately, they can nip it in the bud. The fact that they cannot afford the care and they have to pay out of pocket, which they don't have, resorting to all this, I know Dr. Tony talked about all these pharmacies, are in the corner pharmacies that are not trained and stuff like that. That in all sincerity actually contributes a lot of people dying, or a lot of mobility happening in healthcare in Nigeria too, because people feel that it's the cheaper form for them to take care of themselves than going to an healthcare facility to get actual treatments.
So wait. You know, let me say something here. Today is the only day that I've let you talk this long. Today is the
Okay.
only day that I let you talk this long. Normally, I'll have cut you off like 5 minutes ago. But because you haven't spoken at all, that's why I'm letting you to continue like this. So in all these things that you have said, what is Asiwaju proposing? We've talked about some other things. Now, in this particular situation, because this is a dynamic question.
Yes.
So based on the healthcare manifesto and promises that he has made, how is his promises going to address what you have just talked about?
Well, okay,
In
let's even
2
start.
minutes.
Let's
In
even
2
start
minutes, I've let
from
you rant. I've let you rant as usual. That is
yes.
just 2 minutes.
Besides the infrastructure, you know, he has the infrastructural development plan or something, IDP. I think that's what it's called in the
There is the
manifesto.
National
Yes.
Infrastructural Plan.
Besides that will build all this necessary all this necessary infrastructures in place when it comes to healthcare infrastructure. Besides manning those people, besides putting the manpower there, besides trying to entice more healthcare workers to work in the rural area and all these underserved areas through whether the money they are giving them, the benefits, because even in America, nobody wants to go and work in rural areas. They pay you more or something to go there. So besides all of that, like I said, socioeconomic factor is big deal, which is people need money. Poverty contributes a lot also. So how can you get people out of poverty? He's already talked about it in his economic plan. He's talked about it when we're talking about youth empowerment, women empowerment, agriculture. So it's all linked to that. If you improve people's income, that they can afford to take care of themselves, whether medically or even feed themselves and afford to buy something that is actually good, not like Nigeria people still buy, even if this fish, they go to the market, the fish is quite not good, it's not fresh, they know they shouldn't buy it, but you can only tell somebody that can afford to buy fresh one to go to another store. Somebody that cannot afford it will still buy that and say, I'm a manager. That's is the truth. We should be grateful for the life we have. Not everybody enjoys this. And millions of people in Nigeria are in that category. So one thing that Asiwaju said is going to do is through the empowerment and taking people out of poverty, whether through agriculture, through manufacturing, whether it's through small business enterprises to access to loans and all this stuff. Those will help. But bottom line, access to the facility itself, and not just building a facility, equipping those facilities and putting the manpower that are needed to run those facilities efficiently and productively, because that matters too. That is the key. You need to use so you need that. You need it for education and everything. So yes, you do need all of this.
Thank you very much. Thank you very, very much. And in addition to what you said also, incentivizing the people more, paying them more. Because we have, like I said initially, we have this Japa syndrome, in quotes, like our doctors and our healthcare professionals and nurses all trying to move away. Now the government is saying, you know what, we want to bring you people back. What will it cost us to bring you people back? Because I think I saw it in the news this past week, talking about how to bring diaspora professionals, healthcare professionals, bringing them back. What can we do? Now, does anyone have any other question as regards healthcare, as regards one particular part of healthcare, and how Asiwaju is going to address that healthcare concern? Does anyone have, because you actually made a point, and that point is the point for next week. Because for next week, we're going to talk about youth empowerment and entrepreneurship, and we'll add women empowerment to it. Because you touched on it. My mind is saying that's where we're going to go to next week. I'm glad that you use your mouth to say it yourself. So next week, let
me quickly say something. Let me quickly say something, because you mentioned the issue of Japa. The truth is this: Nigeria cannot compete with Western nations. That's the truth. no matter what, even if we pay a Nigerian doctor. By the way, Nigerian doctors are they are really earning a lot, way more than any other sector in Nigeria. That is a fact.
Yes.
That is a fact.
Yes.
So secondly, no matter what, Nigeria really cannot compete with UK, US when it comes to paying. Now, what Nigeria can do to keep the ones that really don't mind staying back, like if they have to choose, if everything was working, the hospitals was working, is equipped, they are getting paid on time, that they will actually pick their country over any other country, is to do what Asiwaju is proposing, incentivizing them, giving scholarships, doing all these benefits, making sure they are getting paid on time, equipping their hospitals, making sure they are getting represented, doing policies that will favor them too. Those people will stay regardless of what you want to pay. Because if it's all about just how much money you make, then the nurses and the doctors in UK should be coming to the United States. But you know, so I just want to let people know it's not just about the money, it's deeper than just the money. Yes. Because even if we pay them 1 million per month, if they will leave, they will leave, because we can't compete. And it's not just healthcare, even in other areas. So,
and I was talking to somebody about this this morning, or yesterday morning, on my way from the club, and we're talking about purchasing power parity. Nigeria ranks in the lowest quartile when you talk about purchasing power parity, because someone was talking about, I got pissed off. I was watching it live, and somebody was saying, this particular person now charges in dollars. I got livid. I was not part of the live. I just got livid. Like, the legal tender in Nigeria is the naira. Why are you guys? Maybe you guys don't know the negative impact of dollarizing our economy. You are saying it you're saying it like, oh, I'm on na dollars. They charge you. He charges in dollars. Do you know the damage you are doing to our economy? Because now, if you are dollarizing it, for example, so this person gave another practical example. Now you are making your hair now, for example, you are braiding the hair. Maybe in the UK is maybe £50 to braid your hair. I'm just trying. I don't know it too. I don't know what it is. But £50. Maybe in America it's $70 or something like $100. In Nigeria it's maybe 20,000 naira. But you now say, oh, because in the US they are charging $100 for that, or $80 for that, or in China they are charging maybe 300 yuan. So I will now use that
to charge.
Now, what I've done is I've caused inflation. What I've done is I've also made people, because you said, because I cannot afford it, then I might go resort to crime to make sure that I can afford it. What I'm doing also is I'm dollarizing my economy, because now it gets to a point, oh, you can only pay me in dollars. So now the little dollars that we have available, the BDC, Bureau de Change, those ones too, they will increase their price. You are going to go and mop up the little dollars that we have for something that is not important per se. When we need that dollars to go and purchase, like gasoline, for example. Gasoline is very important because of subsidy and all of those things. We need those dollars to go and buy. Or we need the dollars to go and buy wheat, for example, because we still import 99% of the wheat that we consume in Nigeria. 99% of the wheat we consume in Nigeria, we import them. And when you want to import, you are not using naira to import, you are using dollars to import. Wheat is sold in dollars per bushel. Wheat is about $7.40 or 50 cents per bushel, as we are talking today. Today's price in commodity market. Well, I digress. Now we just have to round up, but it has a lot. So next week is youth empowerment and entrepreneurship / women empowerment. So you know, we would get everything together. We'll have more women involvement, more women interactions, and we also hope for questions as regards that. But we have one last question. Call me Wale again. Last question. Northern Nigeria still, and this is going to the both of you, but I want Dr. Tony to talk about it first. 1 minute, so we can round up. My last question. Northern Nigeria still struggles with some pathology that should be eliminated completely. We talked about Lassa fever. by the way, partly due to mistrust in the health system. What plans do you have for community engagement? So, Dr. Tony, that will go to you, and then Mama Tuzi.
Yeah,
So
like we said earlier on, like Lassa fever and also meningitis, which I know that especially during the dry seasons and it's very hot, because most don't really, they are not educated on the importance of vaccination for meningitis. Lassa fever, there's no vaccine yet. Some of the vaccines are still in development at this time. So there's the need for education. Education, awareness about the disease itself, the prevention at this time, the available treatment options, and the available vaccine if as applicable. For instance, meningitis, there's vaccine. Lassa fever, there's no vaccine at this time. And the main thing is there's need to get to the grassroots and educate them. There's no shortcut about it. They need to be educated. They need to be aware and how it can be prevented. Simple things like, okay, keep your food. Don't let rats get on your food. Prevent rats. Get mouse traps in your house. And also meningitis. Get vaccinated. If not vaccinated, let there be ventilation. Don't be in a crowded room, very hot, like that, which enables the transmission of it. It's so simple. Eat healthy, like Ms. Yetunde said too. Healthy. We know that it's expensive to eat healthy. Here too, it's super expensive. You want to buy organic food, fruits, vegetables, is ×2. You want to buy organic chicken, it's ×3. So, but you can still eat healthy by, you educate them. You can bring this, you can eat fresh spinach, fresh ugu, like that. If you want to eat a bar, you want to eat rice, don't eat too much, like that. So they can still in their own little way. So education. What did you say?
No, I'm guilty of that one. They will swap it to Mama Tuzina, but I'm guilty of that Chevalier.
No, you are Ijebu now, but you can still eat small. Don't eat too much.
Yeah. That's a problem for me. That's a problem. But what I try to do, maybe I'm deceiving myself anyways, I work out a lot. A lot. If I'm going to eat my eba is only on Saturday, like afternoon. When it's like that's when I will eat it. Because when it comes to diets and all of that stuff, because of my workout and all that, there are some things that I can only eat in the evening time when I come back from work. There's a type of breakfast I can have. Then my lunch is more of carbohydrates and all that. I don't have a dietitian, but that is how which is
pretty good. You just need to reduce it's not that one should not eat all those, but it's the quantity. You can make the vegetable soup more.
Exactly.
More with fish, nuts. Don't have too much beef, chicken.
You leaking my secret.
No, if you're going to eat beef, just make sure you're eating lean beef.
Lean beef, not the one, and remove all the fat as much as possible.
It's from African store.
Bake instead of frying. Bake instead of frying.
Yeah, I bake, but it's African store. It's from African store.
Don't worry. When you have a woman in your house now that you're married, she'll be adjusting it for you.
No, thank you very much. On a final note,
I think Doctor has actually answered all the questions, but to just buttress it, and I'm glad that Komiwale asked that question. But the thing is, we should not get the misconception that it is only in the northern Nigeria. As a matter of fact, it is all over Nigeria, especially in the rural communities. There's distrust of modern science medicine. They have more trust in their herbs and stuff than this. But you know what? I can't fault them, because even in America here, the Black community have phobia for healthcare system, and because of the history that behind it, that's why. So what we can do is like the doctor said, we need to liaise with these communities, especially like in the north now. They are community heads. They actually play a significant role in the northern part of Nigeria. Community heads. So getting our own social work people out there. We don't need you sitting in the office. We need to be having fairs. We need to be having some educational fair, some educational stuff in their language that they understand. Break it down. Take out the medical jargons that they don't understand. I mean, when was last time we had polio in Nigeria? We even celebrated that we eradicated that in Nigeria. So if we can get that, and in the north that they were having most polio cases, they finally got it and started getting the shots for their kids and all that. Now polio, where is it in Nigeria? So we can do the same thing for meningitis, for all this other one, Lassa fever. But like you said, it's all education. Health promotion is very important. I have a friend in Nigeria that works for Lagos State government. She's a social worker, Olamide. She's a social worker, and what they do, in fact, if I don't have somebody that is in that line, I won't even know that Nigeria will do anything like that. Like seriously. Like Lagos State spends money when it comes to health promotion, but it's not loud enough. I used to tell her, like, it's not loud enough. They need to make it louder and louder. And if we have to use even all this, our Nollywood people and our influencers to help us with education and all this stuff about it, yes, we should use them. They should be interested in making sure that their society is healthy. So those are the kind of things and steps we can take.
Thank you very much. But before we go, just one more minute before we go. This reminds me of one of the research I was doing on Enugu State, and I realized that there's actually one region in Enugu State is a very rural, like very rural area, and a lot of the people there are suffering from blindness. They are not born blind, but as they grow older in that rural community, rural area in Enugu State in Nigeria, they become blind. So now, could it be their diet?
And if it was like you said, if it was another society, they would have researched that. The government would have, because they would have done their own health analysis of that area and and try to see what's going on.
He's already promising in his manifesto that he's going to be data driven and evidence based in making healthcare decisions.
Yeah, but for that to also be successful, though, that's why I'm glad that he said he will work in partnership with state and local government. Hopefully, the state and the local government will be willing and be ready to collaborate with the federal, because the data is going to come from the local level to even get to the federal. Hopefully we won't use politics and bring I don't belong to your party and you can't tell me, because at the end of the day, it's collaboration. You need to work collaboratively. We here now, like Texas is a Republican state, but doesn't mean that, because Biden is Democrat now, so don't get involved. No, if there's any issue, if they need help, if it's something that they need federal to assist, they will send in the assistance. All they have to do is ask. And I know you mentioned something about WHO before I joined. The problem we have is that when it comes to asking for grants and stuff, in fact, there are so many. The HIV one. If we are not transparent, it will affect us. If we don't have the support and backing of our home government, it will affect. You know that even World Bank actually have certain projects. World Bank and United Nations, they have certain projects that they will fund for you. Like you now, you can say, I want to build something for this community. All you need is your government to contribute 10%, and they will foot the rest of it.
Yes.
But the problem is the people that you want to go and meet to help you talk to the governor to fund the 10% are already asking you for 20%. So those are the kind of things that whoever comes in needs to, because if we're going to get help, why can't we take the help? We just need to be more transparent, more straightforward, and stop lying. Yeah.
And Komi Wale now said something again. This Komi Wale, God bless you. Thank you. Because it seems like this healthcare that I'm talking about.
He's the MD himself. That's why.
Because he's very vocal. with the our team member now.
He should come online.
Yeah.
I know,
Come online.
Because of time, you should have come on now. He said uncontrollable diabetes and trachoma are major contributors to vision loss in many of such regions. So as I say, diet, is it too much curry that they are drinking? Or is there something that they are taking, and as they grow older, they begin to lose their sight? And as I called Enugu State, there are different regions in Nigeria that have different issues. So that are region kind of specific, kind of maybe because of their diets and all of that. And on that note, I'd like to thank everyone for joining. It's not been easy to keep the fire going, but we'll keep on keeping the fire going. And like I always tell you, we never, they say, bring him up even if it's for 5 minutes. Okay, by popular demand, they say we should.
You need to come up, Mr. Wale.
They say Mr. Wale needs to come on. They are calling Mr. Wale out. They say I should drag him. Let me see.
You cannot be disturbing me with question and you will not come up.
Yeah, he needs to come and
this
speak up.
on a special request.
He's in the same field as Anthony because they are both MD and PhD.
So let him come.
Me, I'm a baby public health. I'm still in the program, so.
No, you are doing more research now than even me.
Mr. Wale is not picky. It's not request. It's not accepting our request to. I sent it to him. Let me see.
Just a chance, guys. Let him join.
Hold on. I don't know what's going on. I've invited him. He said maybe next time. I don't want to bring you in before. It's the fans that wanted you to come on. I don't want to bring you on. I wanted to leave you in the comment section. I know people like you. I know people Shakara is too much. Shakara is too much. You know you people. Some other time, we'll do a special session. Maybe after the whole election and everything, we'll just talk on healthcare and stuff. We'll be able to bring you on and all that stuff so we can learn. Because outside of this politics and partisanship and things and all that stuff, we are humans first before all of this politics and all that. We just want a better country. If it's Tinubu, if it's Atiku, if it's Showore Kwankwaso, if it's Obi, if it's Kola Abiola, if it's Imolume, there are 18 of them. Any one of them, but we just want a better country.
Better Nigeria. We want better Nigeria.
Like I always say, you can never hear me anywhere tell you that you should vote for Asiwaju. I don't say it. I will only say these are the reasons why I think that Asiwaju is the best candidate. That you should go out there, get your PVCs and vote. But I always advocate for Asiwaju because I think he's the best man to do the job. But then the onus is on you to make that decision. We on this platform will always explain the Renewed Hope 2023. This is his action plan. We know it is 80 pages. We know we have a lot of busy people, out there that may not be able to read them. But we, week by week, we break each topic or each section and give very detailed analysis to the best of our abilities as to why this man, we think, is the best man for the job. He's done it in Lagos. He's doing it in Lagos. He can do it in Nigeria as a whole. They will say Lagos State was the capital of Nigeria. But Lagos State was the capital of Nigeria, yes. He had the potentials. But nobody was announcing the potentials. Somebody now came and announced the potentials. They are now saying, but Lagos State was the capital. So what were the people doing that before Asiwaju? What were they doing? Then look at Nigeria like that. Nigeria has potentials. Now, okay, let's give it to Lagos. Let's give it to City Boy. Let City Boy call it a City Boy. Let's give it to City Boy. Okay. And on that note, do have a wonderful evening. Thank you all for joining. Until next time. Bye, guys.
Bye.